In emergency medicine, time is critical and a rapid diagnosis can save lives. This is where medical imaging plays a crucial role for the diagnosis and to save the life. So imaging helps clinician quickly identify life-threatening conditions and guide treatment decisions and monitor patient progress. So in this video, we will discuss the role of imaging in emergency situation and the most commonly used imaging modalities in the emergency department. So let's begin with why imaging is important in emergency. Because rapid diagnosis of life-threatening condition is very essential. Assessment of trauma and internal injuries, detection of fractures, bleeding or organ damage, and guiding emergency procedures and treatment. Without imaging, many critical conditions could be missed or diagnosed late, so that it will be very crucial for the management of patient. In trauma patients, imaging is often performed using standard trauma protocols such as X-ray, USG, CT scan, and MRI. So these help quickly identify life-threatening injuries. X-ray is the first line of imaging modality in emergency condition. It is fast, widely available, and useful for detecting fracture and dislocation. We can see here, this is the fracture and dislocation of ankle. This is the pneumothorax. We can see here visceral pleural line, and this is the air within the pleural space. This is the lung infection seen as a consolidation. This is the intestinal obstruction. Dilated bowel loop can be seen. These are the dilated bowel loops. And now the foreign body within the abdominal cavity, we can see foreign body. Now the second most commonly used investigation modality in emergency is ultrasound, because it is fast, portable, and radiation free, and it is very easily available. So USG done in emergency is called the FAST is focused assessment with sonography for trauma. Now it is called EFAST, that is the extended focused assessment with sonography for trauma. In FAST we see that the abdominal organs, whereas in EFAST thoracic abnormality is also included like pneumothorax and hemothorax. So this is called the E-fast, whereas the fast is only done for the abdominal trauma or hemoperitoneum, pneumoperitoneum and solid organ injury. Whereas in E-fast, the thoracic pathology is also, or thoracic trauma is also included. Ultrasound helps in detection of the internal bleeding. That is, we can see here this arrow denoting that this is the black area is the fluid within the abdominal cavity in Morrison pouch. This is the hepatic contusion. In case of trauma, this is the area of hepatic contusion. This is the fluid within the pericardial space. So this is the pericardial effusion or tamponade. So this is very essential for diagnosis of pericardial tamponade. Now the ectopic pregnancy. So ultrasound is very good for the diagnosis of ectopic pregnancy in emergency. And ultrasound is also used for the diagnosis of pneumothorax at bedside in emergency. So we can see here, this is the barcode sign for the diagnosis of pneumothorax. Now the another modality of investigation is CT scan or computed tomography. It is extremely important in severe trauma and acute neurological emergency. So it is very sensitive for detecting intracranial hemorrhage. As we can see in this image, this area, this white area is intracranial hemorrhage. This is the fracture of vertebra in spinal injury. This is the pulmonary embolism. So we can see here there is a filling defect or hypodense area is the thrombus within the pulmonary artery. And this is the splenic injury in abdominal trauma. We can see here this is the splenic injury in abdominal trauma. So CT provides detailed cross-sectional images. So this allows the rapid and accurate diagnosis. Now MRI. MRI is less commonly used in emergency because it takes more time, but it is very useful for the diagnosis in case of the spinal cord injury. So for spinal cord injury, MRI is very good and it is superior to the CT scan. stroke evaluation, whereas in case of the hyperacute and acute, CT is not sensitive, whereas the MRI is very sensitive for hyperacute and acute infarction. So we can see here there is diffusion restriction in this area and there is a ADC dark area. So this suggests that this is the diffusion restriction and this suggests that there is a acute infarction. Another is bone and soft tissue injury. So bone contusion could not be visualized in X-ray, whereas it is very better appreciated in MRI. So we can see here this is the bone contusion, and soft tissue injury can be also very excellently visualized in MRI than CT and X-ray. It provides excellent soft tissue contrast. So soft tissue injury is very better appreciated in MRI. In emergency radiology, speed and accuracy both are very critical. So radiologists and clinicians must quickly identify key abnormal findings such as pneumothorax, internal bleeding, that is the abdominal internal bleeding, skull fractures and cranial injury, brain injury, bowel perforation and pneumoperitoneum, bowel obstruction, cervical or spinal injury, and pelvis fracture. So early diagnosis leads to faster treatment and better patient outcome. Pneumothorax refers to the presence of air within the pleural space, and this will lead to the collapse of adjacent lungs. What we can see in this visible pleural line, that is the visceral pleura, we can see here this is the visceral pleural line, and absence of lung markings. As we can see, we can compare right from left side. So these are the vascular marking on left lung, whereas there is absent vascular marking. And hyperlucent hemithorax, we can compare that this hemithorax is lucent than the left side. Mediastinal shift and downward displacement of diaphragm can be seen in tension pneumothorax. As we can see in this image, this is the diaphragm depressed downward and mediastinal shift to the contralateral side. So this diagnosis is very essential because this will lead to the cardiovascular compromise and lead to the death of patient. So tension pneumothorax diagnosis is very crucial in emergency. And if you want to watch detailed pneumothorax, then you can watch my video pneumothorax. Link is given in description box below. Skull fracture and brain injury can be diagnosed very easily on CT scan, and it has very high sensitivity, while plain X-ray have limited role in head injury. So we can see here that this plain CT head shows that these bright areas are the parenchymal hemorrhage, and this is the fracture of the calvarium. This is the 3D image showing the calvarial fracture, whereas this X-ray showing the parietal bone fracture. CT is sensitive and accurate for the diagnosis of intracranial hemorrhage and the calvarial fracture than X-ray. Pneumoperitoneum indicates that the air within the peritoneal cavity, that is the free air. So where it comes from? It comes from the either communication with the external environment or communicating with the hollow viscous perforation. So in case of emergency, it is very essential to diagnose the pneumoperitoneum. So what we see, that is the free air under the diaphragm. We can see here this is the free air under the diaphragm. So this could be visualized in the chest X-ray, as chest X-ray is taken in erect position. So gas under diaphragm can be visualized. This is the another emergency condition is the bowel obstruction. It can occur due to the adhesion, hernia, tumor, or volvulus. On abdominal X-ray, what we see in erect position, the multiple air fluid levels, whereas in supine position we can see that there are multiple dilated bowel loops, as we can see in these images. So these are the multiple dilated bowel loops, and this is the multiple air fluid levels, and there are absence of bowel gas in distal bowel loops. So these are the diagnostic point of the bowel obstruction. So X-ray is sensitive for the diagnosis of bowel obstruction, and for the detail of bowel obstruction you can watch my video on bowel obstruction, and link is also given in description. Cervical spine injuries are commonly associated with trauma, and systematic evaluation of cervical spine X-ray should assess alignment line, vertebral body heights, disc space, and soft tissue swelling of prevertebral space. So failure to detect cervical spine injury can lead to the severe neurological consequences. So what we see in the cervical spine X-ray, that is the alignment. So these are the alignment. There is loss of vertebral body alignment. This is the anterior posterior vertebral alignment. So there is a loss of alignment. This is the CT image. We can see that there is a loss of alignment. Another is the vertebral body fracture. We can see here there is vertebral body fracture in CT. Prevertebral soft tissue swelling. So this is the prevertebral soft tissue swelling. This indicates that there is fracture. So we can see here there is loss of alignment, fracture of vertebra, and prevertebral soft tissue swelling. So this indicates that the cervical spine injury. So this is very crucial in diagnosis in emergency. Now the pelvic bone fracture. So it is important because it may be associated with severe hemorrhage and internal organ injury. So pelvic X-ray are part of trauma protocol in emergency. So disruption of the pelvic ring, widening of the pubic symphysis or acetabular fracture should raise concern for unstable pelvic injury requiring urgent management. So what are the signs of pelvic injury? That is the pelvic ring disruption. As we can see here, this is the pelvic ring disruption. Another is the widening of pubic symphysis. We can see here there is widening of pubic symphysis. This is the 3D image, CT image, and these are the fractures. We can see here, these arrow denotes the fracture. These are the fractures. Now the foreign body aspiration or ingestion. This is very commonly seen in children as well as in the trauma patients. Radio opaque objects such as coin, battery or metallic objects are easily visible on X-ray, whereas the radiolucent like seed, meat, ball, these are not visible on X-ray, so CT is required, but metallic objects easily visible on X-ray. Early identification is essential to prevent airway obstruction and soft tissue damage. So what are the common location? Most common location is the airway. So in pediatric and comatose and trauma patients, airway, foreign body is most common. After that the esophageal and then soft tissue. So we can see here in this X-ray, this is the trachea, lucent area is trachea. So posterior to trachea there is a linear foreign body. So this is the esophageal foreign body. Another case showing the, this is the another case of esophageal foreign body. Here we can see in CT scan. Now another is the, this is the soft tissue foreign body. We can see here, this is the ultrasound showing a linear echogenic object with posterior acoustic shadow. This suggests the foreign body. We can see here soft tissue foreign body. In these two images, we can see that in first image that there is a radio opaque left lung with mediastinal shift to the left side, but there is not any visualized foreign body. But in the second image, we can see that there is a radio opaque foreign body in right main bronchus. In first image, there is a radiolucent foreign body in left main bronchus, whereas in the second image, radio opaque foreign body in main bronchus. So in pediatric patient, most commonly, seeds, peanuts can be aspirated by the children and this will lodge into the bronchus and this could not be visualized in X-ray. So this will lead to the collapse of lung. So this is very essential to diagnose in emergency to save the life. Like, share and subscribe my channel to get more such videos. Thank you for watching.